Okay, so this next segment is going to be looking at antibiotics and other drugs that we can use to basically control or treat some of these ulcers that can materialize within the GI tract. And so, of course, we're going to go into Helicobacter pylori or H. pylori. Remember from micro that it's a gram-negative rod, and basically it's going to colonize the luminal surface of the epithelium within the GI tract. And this has got an interesting story. These two guys back in 2005 won the Nobel Prize in Physiology and Medicine. Of course, this discovery occurred much sooner than this, but this really kind of paved the way for implicating that the recurrence and then actually the initiation of some of these GI ulcers was indeed due to this presence of this bacteria within the GI tract. And when you eradicate this bacteria, you greatly reduce the number of ulcers, and also you reduce the risk of cancer by dramatic numbers. And so there's several that are approved treatments. We'll talk about two. These are the more common ones. If you look up some of the treatment guidelines in various resources, there'll be other approved treatments, but these are the main common ones that you'll encounter. So the first is looking at combining bismuth subsalicylate, which is actually just the pink stuff, Pepto-Bismol, metronidazole, and tetracycline for 2 weeks. And then the other treatment is omeprazole and clarithromycin for 2 weeks. Okay, and so this is a kind of a nice H&E stain of some of those bacteria that are associated with some of those ulcers. I got that from the web. And so let's kind of review these antibiotics. So metronidazole, under the brand name Flagyl, is kind of the go-to drug, as it says here, for the treatment of a lot of different infections, both anaerobic as well as protozoal infections. Of course, this is bacteria. What it does is it basically produces free radicals, and so it's kind of like chemotherapy in a sense. And so these free radicals will accumulate within these bacteria, and that leads eventually to dramatic toxicity and then death. And so it's chemically related to a group of drugs that basically affect ATP. And so basically, if you mess around with mitochondrial ATP processes, you get the production of free radicals that attacks DNA. The DNA becomes unstable, and eventually toxicity and death will ensue for the bacteria or the protozoan. Tetracycline is your classic kind of protein synthesis inhibitor that we talked about earlier on in the year. Mechanistically, it's going to target the 30S ribosomal subunit. You get really good distribution of tetracycline into the ascites, into bile, into the synovium, as well as into the CNS, which is why you'll see tetracycline used in other diseases. Clarithromycin is a macrolide antibiotic, binds to the 23S subunit, remember, which is part of the 50S subunit, and that's going to also inhibit bacterial protein synthesis. So these three drugs work really well for treating H. pylori infections, and of course you have to take into effect the underlying patient health, renal and hepatic health and physiology, as well as potential drug-drug interactions and allergies, as in the case of tetracycline. Okay, so those were the antibiotics that were used to treat H. pylori infections. Let's briefly talk about Tums. These are antacids, and so probably all of you have at least heard of them, if not have taken them yourselves. Usually we associate Tums with, maybe like a spicy meal. I've used my share of Tums eating spicy buffalo wings at restaurants and so forth. And so basically this is how they work. All the drugs that we've been talking about affect various processes within the parietal cell itself. Tums really just kind of neutralize the acid that's pumped out of these parietal cells. And so it's basically just pure chemistry. And so if you've got a lot of acid, which is basically a proton, remember, you give the patient Tums, or actually more likely the patient will take Tums by themselves, and Tums are basically calcium carbonate. That carbonate interacts with the hydrogen, and basically the pH of the GI, stomach lumen, becomes neutralized. Okay, and so the dose, or the dosing guideline for antacids, and again, these are weak bases. So the mechanism here is Basically, one dose of the antacid 1 hour after meal typically neutralizes stomach acid for about 2 hours. It's kind of like the rule of thumb. What does this mean? Basically translates to really fast relief, but a short duration of action. Okay, so uh, especially some patients, they may have to get up several times throughout the night if their acid reflux or their heartburn becomes problematic. Okay, there is aluminum in some of these salts that are formulated, and there's various formulations. I mean, I had mentioned Tums earlier on. Tums is calcium carbonate plus or minus aluminum and sucrose. But there's also, Rolaids, Mylanta, Gaviscon, um, Maalox. These are all different formulations that are all kind of loosely grouped as antacids. Okay, so some of them do have aluminum. That will react with the gastric acid to basically produce a salt that is insoluble. Remember, aluminum is a cation with a positive 3 charge. Um, this will promote constipation, which in the case of a GI type virus or upset stomach might actually be beneficial. Some patients may complain of nausea and vomiting. So this might actually be beneficial. A lot of these over-the-counter antacids contain at least some version of calcium, most often calcium carbonate. Um, excuse me, there are magnesium-containing salts. They're not really absorbed that well, which is good, and there may be some type of a laxative type of effect. And the prototype here is Epsom salts, which we typically think is a soaking aid for sore muscles, but this actually can be ingested. There are combination tablets that have both magnesium and aluminum to both offset constipation, as in the case of aluminum, and to offset diarrhea in the case of magnesium. And those are Rolaids, Mylanta, Gaviscon, and so forth. And then Maalox has the special added simethicone, which can be used to treat gas production. Okay, so these are all kind of the various drugs that are loosely classified as antacids. All of these are over the counter. They all work essentially pretty much the same. If you want to get into the real specifics, you may want to maybe think twice about having high amounts of aluminum given to patients. I don't know, maybe pregnant women, patients with maybe renal problems. You may want to shy away from excess amounts of aluminum, but 1 or 2 doses is probably okay. If they're taking it chronically, you may want to consider some other alternative. This is a nice kind of a summary slide that just basically looks at all the different physiologic and pharmacologic targets and how we can basically regulate or alter gastric acid secretion. So all the different drug classes are basically summarized on this diagram, and I think it's kind of a good study tool. Let's take a break and look at the last segment, the prokinetic and the anti-diarrheal agents, which is always a pleasant topic. We'll take a break here and we will resume shortly.